Is Mental Health Awareness Month, and this week we continue the conversation with Chris Nelson from UofL Health Peace Hospital. Thank you so much for coming on today.
Well, thanks for having me.
So we know it's important to you to normalize this mental health discussion and normalize the availability of treatment for people, not just those diagnosed with a mental health condition, but really everyone. So let's start with some of that knowledge. When do you know it's the right time to maybe ask for help or get some treatment?
Sure, yeah, and it's a lot of people talk about mental illness all the time, and we like to really also focus on mental health, right? And so preventative measures, not waiting until there's a crisis, and one of the things I do with our patients at Peace Hospital when they're not familiar with mental health treatment, it's awful to do my mental health 101, and I kind of have to break it down for all ages, including kids, and because a lot of people think like, oh, if I have a therapist, that means there's something wrong with me, and that's absolutely not the case. And so I'll say, well, when there's something wrong with your body, who do you go see? You go see your primary care physician, right? Well, just like everyone should have a PCP, everyone should have a therapist. It doesn't mean you got to go see them every day or every week rather, but they're there when you need them, and they know your story, and you don't have to start all over. And so you can go to someone that's familiar with you and knows your history, and it's just way more helpful, especially these days. A lot of therapists are full, and so it's good to establish a relationship with a therapist and just have that available.
Before you really need them, you already have that relationship. That's important.
Exactly.
So what about in someone who you might be close to? What are some things to look for that maybe someone you love is struggling?
Sure, and just basically looking for changes, things that seem unusual, if somebody's sleeping more or less, eating more or less, their mood seems to have changed a lot, they're isolating, those are just some signs of that somebody could really need some more support, and maybe it's time to start opening that conversation about getting some help.
And finally, resources. This is so important. If someone's hearing this thinking, okay, I do want to take that first step, where should they look?
Okay, so there's lots of options. Of course, we'll start with UofL Health and our options. Peace Hospital offers needs assessments, level of care assessments 24/7 at Peace Hospital. We also reach out to all the different UofL Health facilities. We service the JCPS schools. So there's lots of options there. And then if a patient goes to ULP, has a PCP at ULP, they can be set up just a very simple order put in, referral to what's called Peace Now. And that's a very rapid response. A provider will reach out to the patient and do an assessment and kind of get them where they need to go, provide them with referrals and that kind of a thing. But for the folks that aren't patients with UofL Health or ULP, there's always 988, which is just like 911. You can dial 988 and it will go right to a nationwide network of professionals, licensed clinicians that can refer folks where they need to go. And then here in Kentucky, we have this great resource online called myky.info, and it's a really user-friendly interface that you can find all different kinds of resources. And then lastly, psychologytoday.com. You can find a therapist on their website too. So lots of options.
Lots
it's a lot easier than
to
ever
get
was to get to get services.
Awesome. Well, Chris, thank you so much for coming on. We really, really appreciate it. 988, a good number to remember there. Well, straight